I will call to Clive from Financial Times. Clive, can you hear us, please?
Yes, thank you very much indeed. Dr. Tedros, in your introductory remarks, you talked about some countries where there was alarming inactivity and alarming levels of inaction, you said. And also last week you were critical of some countries, but you declined to name them. Are you willing to say which countries, in your opinion, or that of your colleagues, are not doing enough? Thank you.
Yeah, I think the answer to that question is, you know who you are. The WHO doesn't interact in public debate or criticize our member states in public. What we try to do is work with our member states constructively, pointing out to them when we believe their measures are not adequate, aggressive enough or comprehensive enough, and we've taken that opportunity, and the Director General has taken that opportunity on multiple occasions to interact with many member states, to indicate where countries can improve, and member states are always telling us how we can improve as well. So I think that's a very important tenet of our relationship. But I think if we look at behaviours that we want to see more of, certainly diagnostic testing algorithms that only test a small proportion of people who are likely to be COVID-19 isn't the way forward in this epidemic. Not a way forward in this epidemic. So we've seen some countries have diagnostic criteria that require you to be fully symptomatic and over a certain age in order to qualify for a test, or having still linking testing to travel to China and other things. So there are countries who have not updated their surveillance regimes to be adequately up to date with the current threat. So surveillance systems have to improve. In terms of case finding and isolation, some countries clearly, and you've seen this through the infection of health workers, have not yet got in place necessary measures to stop infections transmitting at hospital level. And we must protect our frontline hospital workers. Other countries, when it comes to case finding and contact tracing, have been too willing to give up on contact tracing at a very early stage in the fight against the epidemic. They have a sovereign right to choose their own strategy, but some countries really do need to stick at contact tracing for that bit longer and to suppress the to try and suppress the transmission chains. And again, some countries have not been communicating well with their populations and creating some confusion in the minds of the population, and risk communication and trust between governments and their citizens really does need to come to the centre. Other countries have struggled to create coordination between the different agencies and sectors of government. We've seen other countries struggle to establish a very effective coordination between the national and state, or the national and provincial level. So again, epidemics are a stress test for the system. They stress every component of the system. They stress governance. They stress trust between government and the citizen. They stress the hospital system. They stress public health systems. They stress the economic systems. The issue is how much resilience is built into those systems. And I'm frankly will have to say to you that in many cases what we're witnessing across society is a lack of resilience. Our hospital system is running, the DG has said it, as a, I can't remember the word you used last week, but it's lean and mean. So our hospital systems are designed to deliver at 99% efficiency. They don't have any space to deliver more. We have a deep distrust very often on health messaging from governments to citizens. There are things, you know, we need to be working on more between epidemics, but right now we're in a fight. We're in a big epidemic, and we need to work on those things right now. So I'm certainly not going to single individual countries out, but I think if most countries look at the list I've given you and give themselves a scorecard, I don't think anyone's scoring 100% right now, and neither is WHO. So we all need to just get on and get better at what we do.